before I start this class about dermatology as a career, let me just briefly introduce myself. So I did my undergraduation from Bangalore Medical College, and that is from where I know Dr. Kishan. So Kishan sir was like that one senior who did, everything and who was, good at everything. And other than the curriculum, he was into a lot of extracurricular activities as well. We used to play badminton together. And when he said that I have to take this class about dermatology and career in dermatology, so I thought that White Army would be the perfect platform for me to send a message across to all the newcomers and the juniors who want to take up dermatology as a career. And there are a lot of misconceptions about dermatology, and today I'm here to clear all that. So after my undergraduation, I did my post-graduation from Government Medical College, Rajkot. And after that, I came back to BMC for a fellowship in pediatric dermatology. Then I did 1 year of SRship in Bowring. And currently I'm working as assistant professor in Bowring and Lady Curzon Hospital. Okay, so we'll start with the seminar. So before we get into it, I just want to tell you what the degree is. What is the degree which you get once you do dermatology? Because there are a lot of short forms nowadays which are associated with dermatology, and what is the correct one? So DVL is the degree which you get once you do an MD in dermatology. So DVL is dermatology, venereology, and leprosy. Okay, so why this is important, I will talk about it in the later slides. So MD DVL is the degree which you get. Okay, so this IADVL is our Association of Dermatologists. It's called the Indian Association of Dermatologists, Venereologists, and Leprologists. So they keep publishing short news stories and newsletters about what it takes to becoming a dermatologist. And this is very important. Why, again, I'll tell you later. So this is the basic thing: 5 years of undergraduation internship, 2 to 3 years of post-graduation. So why 2 to 3 years is mentioned is because there is a 3-year MD. So there was a 2-year diploma before, but right now the diploma is obsolete. There are no more diploma seats in dermatology. All of them have been converted to the MD seats. Okay. So, and many years of patient care. So this is what it takes to becoming a dermatologist. Okay. So this is a very important slide. So I was just Googling something and I came across this: dermatologist courses without MBBS. Okay, so can you see a list? They say, and this is from a very popular website. They say that it's a list of globally recognized dermatology courses without MBBS, and you can see a lot of this happening nowadays everywhere. So diploma, the first 3 things: diploma in skin, diploma in dermatology, was valid before. And a lot of my seniors are there who have done a diploma and who are doing very good. So that was recognized. That is a totally valid degree. But you can still see a lot of this BSc, MSc, PhD, postgraduate diploma in clinical cosmetology. We see a lot of quacks coming up, a lot of, Ayurvedic, DHMS doctors, who have pursued this small courses or short-term degrees in dermatology and who are doing a lot of aesthetic and cosmetic procedures. So these are the degrees which are not recognized by the NMC. And why I feel this is important is that once you take up dermatology, and if your patients are smart, if your patients are educated, they will always check your degree. I've had a lot of patients who have asked me, "Doctor, are you an MD? What is your qualification?" So they do. But there are a lot of patients, especially if you're practicing in tier 2, tier 3 cities, who don't know what you are and who will just go to the one who does the cheapest procedure. So you have to educate. It's your duty as a dermatologist to educate patients about who can treat your skin. Okay, so that is why the slide is important. Okay, so moving on to, so I have covered the topic under the questions which Kishan sir had sent to me. So these will cover, what is the scope of dermatology and why you should do dermatology, what are the pros and cons, and when you're taking up dermatology, should you take up MD or DNB? Should you do it in when you're setting up your practice? Should you do it in the periphery or should you do it in the city? And we'll discuss about all these things and what should you do during the 3 years of residency and what is the path post residency. So these are the things which we will cover very briefly today. Okay. So why dermatology? So to tell you about this question, about my own personal experience. So let me just tell you a brief story about how I got into dermatology. So during my internship days and during my undergraduation days, surgery was my first preference. So I was always thinking about surgery and plastic surgery, or otherwise dermatology and something to do with dermatosurgery, because I was always interested in this microsurgeries. So I did take up surgery in a very reputed government college in Mumbai. But once I saw the conditions there and what was happening there, I mean, I sort of changed my mind, and in the next round, I took up dermatology because there is nothing which which should affect your physical health, which should affect your peace of mind, and most importantly, which should affect your mental health. So don't choose a branch which is going to do all these things. So what your personality is, so matters a lot on the branch which you choose. So if you're somebody who is extremely laid back, you can't just say, I'll take up surgery or I'll take up OBG, you'll definitely regret it. So, and if you're like a very charged up person, a very hyper person, and who's, energetic, and, who doesn't want something which is a little more mild, then you can take up surgery, OBG. So your personality depends a lot. So dermatology can give you a very balanced life. If you can, like you can see, it is, and I feel it is very important for you to have a balance in life. So your work should not be taking up more than 50 to 60% of your life. I have seen a lot of my senior colleagues, senior dermatologists, with all due respect to them, who just don't want to retire, because I feel that their whole world revolves around their subject. They don't know what else to do, because this is what they have been doing for the past 40 to 50 years. So I feel it's very important to have a hobby. It can be anything. It can be anything which you want or which you always wanted to pursue. But other than the subject, other than medicine, I think it's very important for you to have a hobby so that you can balance your life. So in dermatology, that is possible. You can practice dermatology. You can also still do whatever you want. Okay. So this slide is, again, I'm a person who loves adventure and outdoor activities, and I have traveled a lot. Not very much during my post-graduation days, but after once I finished my PG, I was able to travel a lot thanks to dermatology. Okay, and the second advantage or the pro of why one can take up dermatology is it allows you to have a wide range of options. Like you can join a medical college, or you can go into a corporate, or you can have your own private practice. I mean, you can say that this can be done with all the fields. But what I mean to say is, even if you want to start up your own private practice right away, you can do that. Like suppose you're a super specialist surgeon and you're like a plastic surgeon, or you're a urologist, or you're a neurosurgeon, you can't do that right away. You have to be associated with the hospital to do your OTs and all that. But dermatology, being an MD branch, is not like that. You can right away get into private practice, and medical college option is always there. But one disadvantage with dermatology when it comes to medical college, what I have observed in the recent years is that there are not many vacancies in medical colleges. Usually we see a lot of vacancies for surgery, medicine, and OBG. Usually there are like 4 to 5 seats in general medicine and general surgery, and usually dermatology just has 1 seat because the requirement is less, because the OPD case will not be as much as the medicine and surgical fields, so the requirement is less. Okay, so getting into a medical college is a tough competition when it comes to dermatology. Same as corporate. Even in the corporate hospitals, the requirement for a dermatologist is less. If they have one dermatologist, very unlikely that they will go for another. So there are pros and there are pros and there are cons as well. Okay, but you have a wide range of options is what I want to say after dermatology. Okay, then the practice of dermatology is extremely satisfactory for people who are more into hardcore clinical dermatology. You can do that, and for people who are into cosmetic dermatology. So I have to tread very carefully here, because cosmetic dermatology is not really in the curriculum of dermatology. Remember, if I told you DVL is dermatology, venereology, and leprosy. So cosmetic dermatology doesn't really come in the curriculum, and a lot of us are now writing, including me, we write dermatologist and cosmetologist. So cosmetologist is a very like a confusing term, And there is a lot of controversy around this word, like cosmetic dermatology. What is it and who can practice cosmetic dermatology? So let me just discuss about this cosmetic dermatology a little bit. So this was an article which was written in our journal. There is a journal called IJDVL. It's called the Indian Journal of Dermatology, Venereology and Leprosy. That is one of the major journals which we read. And Dr. Sahana P Raju is a very experienced dermatologist. He wrote this article called the Dermatology Curriculum Searching for Balance. So I just want to very briefly read one or two lines from this article. Here, Sir says that most of the residents who join the MD course with the ultimate objective of opening up a practice which would enable them to earn well after completing the course, which of course would mean getting into a predominantly cosmetic-based practice. If that is indeed the case, why make them go through 3 years of rigorous academics, putting a strain on them, on the teaching faculty and on the system, when they are not going to put it to use? It's like some of our MBBS graduates going into business or joining the civil services, a real waste of time and money. So this is extremely true, but I don't completely agree with Sir on this. So what he says here is that most of the MD students or most of the people who take up dermatology nowadays, sorry. Yeah, so most of the people who take up dermatology nowadays as a postgraduate course just think about, like Kishan sir also said, that it's very lucrative. That lucrative part is there, but they only come into dermatology thinking from a cosmetic point of view, that they want to do this, they want to do the lasers, they want to do injectables. So all that is of course there, but MD dermatology, what you have to remember is it was a part of MD general medicine before. So none of this cosmetic stuff was there. All that has come up in the the recent years. And the postgraduates who are coming nowadays are least interested in hardcore dermatology, like because they know that none of this will be put into clinical practice. Like when you are a PG, you have to study extensively about leprosy. You have to extensively study about connective tissue diseases like lupus and systemic sclerosis. You have to present cases, and you will have a lot of patients of pemphigus and bullous pemphigoid and all these things, which you will never see in your private practice, or once you join a corporate hospital, you will never see these cases. So they already come with that mindset that why should we read all this when we are not going to do it? So what they focus on is things like acne and melasma, and getting to know, attending CMEs about aesthetic dermatology, about lasers. So this is totally true that the curriculum of dermatology should be changed. Okay. Okay, and this is the most important reason why somebody should pick up dermatology, and it's true for all the branches. Like if you're passionate about it, then do it. We're coming to the cons of dermatology. This is actually something which I have heard a lot. Like, don't you want to be a real doctor? Especially during the recent COVID pandemic, people were like, why are you posting dermatologists in the COVID ward? Why are you posting them in the ICU? Like, do they even know how to check the BP and the pulse? These are actually things which I have heard or experienced personally, because people just think that dermatologists are glorified or, glamorous beauticians. That is not at all the scenario, but it is something which you will have to endure, and you will have to fight your way through it if you're a dermatologist. Okay, so some of the cons are it is saturated. Yeah, that is again true for any branch. Any branch nowadays is saturated. But what I want to say by the term saturated is you are not only competing with other dermatologists, you're actually competing with a whole range of dentists and Ayurvedic doctors and homeopathic doctors and oromaxillary facial surgeons and whatnot. Like you're basically literally competing with anybody, even the beauty parlors, chain of clinics like VLCC. You're competing with all these people because everybody is doing basic cosmetic procedures now. So that is what I mean to say by the term saturated. So I believe that there are enough patients for everybody. So our country has an ever-growing population, and there is no dearth of patients. Even if there are two dermats sitting in one road, you will still get patients. But when it comes to dermatology, that doesn't happen for other branches. You know, you don't see like a cardiologist or an orthopedic surgeon who's fighting with, you know, like some other branch of people while taking the patient. That doesn't happen in other branches. It only happens with dermatology. So it is very important for us to educate people about whom to consult. And the second one is expensive equipment. Again, this is true for all the branches. So in the next few slides, I have explained about what are the basic things and how much will it cost you and what I started out with. So I basically started out with this. As you can see, magnifying lens is the basic instrument which you need in dermatology practice, and the machine in below that is a cautery machine. It's a radio frequency electrocautery machine, the basic one, and you can do like a wide variety of procedures with it. Initially, this is all you require, and some few chemical peels. So this is what I bought initially, and all this comes under 1 lakh. Okay, you can cater up to majority of your patients only with this. And recently I expanded to this. So the first instrument which you see, that's a derma roller, and the next one is called a microderma abrasion, and the one below that is a centrifuge. So centrifuge we use to prepare PRP. So PRP again can be used for a wide variety of conditions like hair fall and skin rejuvenation and all these things. And the next one is a hydration machine. So this comes within 1 to 2 lakhs. So if your budget is this much, you can attend to majority of your patients. And if you still want to expand your practice, and all these are the premium lasers, like there's a fractional CO2 laser which will treat your which will treat scarring of any type. And then there's something called Q-switched Nd:YAG laser which treats pigmentation. And there's something called a diode laser which is majorly used for laser hair removal. And there's something called MNRF. So that is also something for skin tightening and rejuvenation and scarring. So these are the ones which are a little more expensive. All these machines come, each one of them costs between 10 to 30 lakhs. So this we can do as you grow into your practice. So by expensive equipment, I mean that you don't have to buy the most expensive of them initially, but once you start settling into your practice, you will need to invest a little bit. But again, that is true for all the branches, nothing particular to dermatology. Okay, so the most important the disadvantage of becoming a dermatologist, especially in India, is anybody thinks that they can become a dermatologist. Okay, so just to give you a few examples, all these are photos which I've seen in Facebook. If you can see, this is a beauty parlor lady who's actually injecting PRP into the face, who's doing facial PRP, who's doing micro needling. Okay, and then there's this person who's an MD in, I think, Ayurveda, who's doing plastic surgery, hair transplant, laser, slimming. And VLCC came out with this ad recently that joined our diploma in cosmetology. And there is a 5-day workshop for a training program in cosmetology. And if you can see here, the last photo, it's combined cosmetology with basic beautician and professional makeup. So all these lot of misconceptions among the public about who a dermatologist is. This was not at all the scenario a few years ago, but because of all these pseudo dermatologists which are coming up, it is sort of our responsibility to make sure to advise the patients, to who they have to consult. So NMC also came out recently with a lot of guidelines, but I don't know how much of it is being practical. NMC says that only MD, DNB dermatology, MCH, DNB plastic surgery should perform aesthetic surgeries, including hair transplants. So aesthetic surgeries is a very wide term which includes everything, right from a chemical peel to derma roller, microderma abrasion, the lasers, PRP, Botox fillers, injectables, threads, hair transplant, all these come under aesthetic surgeries. NMC says that only MD, DNB, dermat, MCH, DNB plastic surgery, these are the only people who can do it. Okay, so this again, all lot of articles coming up. So all these articles come up when a complication happens. So when a complication happens, then the patient always comes back to the basic, dermatologist. So they say that before you go in for any invasive operation, even if it is a minor cosmetic procedure, always check the credentials of the doctor. Okay, so they say that doctors with just the basic MBBS degree or even worse, diploma holders in cosmetology, dentists, homeopaths, and dietitians are conducting hair transplant, liposuction, rhinoplasty, and other surgeries. And all these is extremely true. Forget about beauty parlors conducting, PRP and Botox is minor. Dietitians and dentists are even doing hair transplant and rhinoplasties. Okay. So again, this is another guideline which came out from the NMC. It says that anybody who can perform a hair transplant, they have to be trained in all this, like, active, you have to know what is active scarring alopecia. You have to know what is the pre and post transplant medical care required. What is the basic knowledge. You have to know the hair physiology, pathogenesis of scarring and non-scarring alopecia, anatomy and physiology of hair, scalp vasculature, the nerve supply. You have to be trained in all this. And even MD dermatology doesn't have the hair transplant is not included in the curriculum of MD dermatology also, which is why, going back to that article by Dr. Sahana P Raju, that the MD dermatology curriculum has to be revised as well. Okay, yeah, so these are the pros and cons of dermatology. So just to sum up, it mainly depends on your passion. If you're interested in dermatology as a subject and not just view it from the money making point or from the lucrative practice, because that is not always true. You will have to compete with a lot of people, especially if you're going into cosmetic practice. So if you're passionate about dermatology, then take it up. Otherwise, I wouldn't recommend it. So coming to how to choose colleges, again, all these are very basic differences, which all of you know. Government college has more caseload, more OPD, more inpatient, and you get to do more number of hands-on procedures, whereas in private colleges, hands-on procedures are almost usually nil, because the patients are usually paying a lot of money to get their skin treated and for people to do lasers and injectables, and those are not usually given in the hands of the PGs. The staff usually do it. And government, the most important advantage is that you get a stipend. When it comes to private hospitals, you have better equipment. That is the number one advantage. Like where I studied in Government Medical College, Rajkot, only when I was in the final year that did we get lasers. Like we got a fractional CO2 laser when I was in the final year. So I had only experience in handling the fractional CO2 laser. I did learn after that. But if you're getting a lot of exposure as a postgraduate in lasers, then as soon as you finish your post-graduation, you don't have to look for further fellowships, or you don't have to look for further courses to learn these lasers, because you'll already sort of know what to do. And the second one is better availability of drugs. By that, I mean the patient clientele or the crowd which comes to a private hospital, they are a little well off and they are able to purchase a lot of drugs. Like suppose I want to treat a patient with pemphigus with rituximab. So rituximab costs around 18,000 rupees, and you cannot give that in a government hospital, right? But you can use a lot of these biological drugs in private hospitals. You can use secukinumab, etanercept, all these drugs for psoriasis, which are extremely expensive. So studying in a government hospital and working in a government hospital, I have nil to almost very little experience with using biologics. But when you're in a private setup, that advantage is there, that you will have better equipment and you will learn about the more expensive therapies available. Okay, and coming to MD versus DNB, the obvious reason MD is it's easier to get into a medical college. Like if you want to become a faculty in a medical college, DNB is not accepted anymore. DNB and diploma. Diploma is accepted if you are doing a secondary DNB. Like if you do a 2-year diploma, and if you do a secondary DNB, like a 2-year secondary DNB post diploma, then that is considered equivalent to MD and you will get into a medical college. But only primary DNB or only diploma will not allow, medical colleges don't usually allow you. MD, there are more number of seats. I have put up a slide where I'm showing the number of DNB seats. It's actually around 12 or 13 all over India. So that is again lesser seats. And in MD, you get to do a thesis. So I don't know whether this is a pro or a whether this is an advantage or a disadvantage, but I feel that doing a thesis, you will have extensive knowledge on that one topic. So that is an advantage according to me. And yeah, you are motivated to do a lot more publications and a lot more presentations in MD. In DNB, they usually don't motivate you to do publications and presentations. Okay, so even if you are doing a DNB, you can always go into corporate or private practice. Nobody asks you in a corporate setup whether you are an MD or DNB. It all depends on your clinical skills, so it doesn't matter. Yeah, again, like I said, lesser seats and post-diploma DNB. So primary DNB, there are 13 to 14 seats in India. Post-diploma secondary DNB, I think there are only 1 or 2 seats. So I have put up a list of colleges which have primary DNB. A few in Delhi, West Bengal, Bihar. Then there's one in Gujarat, Jammu, Chandigarh, Pondicherry, Kerala, Maharashtra, Andhra Pradesh, and yeah, that's it. So the total number of seats comes up to 11 or 12. So you do have a lot of competition among DNB as well. So if given a choice about MD or DNB, always prefer MD. But if you are really passionate about dermatology and you're not getting an MD seat and you really want to do, then you can always go for DNB. It's as good as MD. So this is the last comparison, peripheries versus cities. So this is again very obvious. Peripheries, it's easier to make a name because you don't have a lot of competition. You're not competing with a lot of people. Usually in a range of this much kilometers, you're the only dermatologist, especially if you go to tier 3 cities. So that way it's easier, and then there is more caseload and less competition. So I've seen my seniors having OPDs of 30 to 40 patients in a single day. That cannot happen in places like Bangalore, Delhi, Mumbai. There's a longer curve, but you do get to do more aesthetic procedures. But that is not true anymore. Even in the peripheries, there are a lot of people. Before, it was like only people of the higher middle class or the upper class wanted to have a lot of injectables, Botox and lasers, and they were aware about all these procedures. But nowadays, even the lower middle class and the middle class are also aware of all these procedures and are coming in for a lot of procedures. So even in the peripheries, you can do a lot of aesthetic procedures. It doesn't matter. Finally, I think it depends on where you want to settle down, where your family is. Okay, so coming into dermatology residency and such, first I've discussed about what are the books that you're supposed to read. So this is like the Harrison of dermatology. It's called the IIDVL. This was written all by Indian authors. It has 3 volumes and it is a must read. You have to read it cover to cover. I'm one of the assistant editors of this book. This was a new edition which recently came out, and it's a very good book. You have to read every page of it, all the 3 volumes, I would say. Okay, and I have divided the books into must read and good to read. Okay, so must read is IDVL, and this is another book called Bologna. It's again an international author, but it's an extremely good book. And the other one is called Rooks. So Rooks has 4 volumes, extremely good, and it is a must read. And that was for core dermatology. For leprosy, we have 2 books. One is called the IAL textbook, and one is called Joplin's handbook. So these 2 you have to read. And for venereology is nothing but STDs. So for STDs, we read this book called V.K. Sharma. And for the drugs in dermatology, we read this book called Warburton. All these are must-read books. Okay, and then good to read. If you are somebody who is very enthusiastic, or somebody who has a lot of time, you can read these books. But when you're doing a case presentation, it's important that you read all these books. You read that particular topic from all these books, and then you make your own set of notes. I've covered that. So this is called Fitzpatrick, and this is called Hastings, and the other STD is called King M. Holmes. So all these are very good books, and I have personally read all these books. Yeah, and pediatric dermatology I had to put up because it is my forte. I didn't read these books during my post-graduation days, but I did read these 2 thoroughly during my fellowship days. So this is called Horwitz, and the other one is called Harper. Both of them are extremely good. Pediatric dermatology. Yeah, and then coming to a few other books which are available, mainly these are for the fellowships. So we read all these books in the fellowship, post MD fellowship. So this is called Satish Sawant textbook of dermatosurgery, and there's another one called ASCII textbook of cutaneous and aesthetic surgery. This people who are doing dermatosurgery have to read this. And there's an IDVL textbook of trichology, mainly for the hair disorders. People who are doing a trichology fellowship usually read this. But in your postgraduate days, you don't have to read it, but you have to read the must-read books which I've already put up. Okay. So now I have divided into what you're ideally supposed to do in the first, second, and final year. This is just to give a brief overall. You can try to follow it. Okay. First year is basically meant for learning the basics clinical skills. See the cases in the OPD and read what you have seen that day. The most common cases like tinea, psoriasis, vitiligo, alopecia, melasma, acne, and then I made my own set of notes in the first year, and this is what I mean. You have to read all the textbooks because you have a lot of time. You don't have like a deadline, so you can keep one topic for 2 weeks and read everything which is possible. Okay. And the first year is mainly meant for selecting thesis topic. Again, selecting thesis topic and going about your present thesis, how to do thesis is very, very extensive. So you will get a lot of guidance from your seniors and staff when it comes to selecting a thesis topic. And I cannot give like an overall one fits all guideline for selecting a thesis topic because it depends on the college you're working in. It depends on the type of patients and the number of cases and what type of cases you most commonly see. Like my dissertation was leprosy. It was clinical and histopathological correlation in leprosy because I did my post graduation in Gujarat, and Gujarat is endemic for leprosy. There are a lot of areas along the coastline in which leprosy is still very, very prevalent. So we had a lot of cases coming from a lot of cities. Everything was referred to our hospital. And because of that, I did my thesis was on leprosy. So you will have to take the help of your seniors and staff. Second year is I have in the next slides I have presented in detail how many papers, how many posters, how many publications you have to do. So concentrate on doing a paper and poster presentation in the second year, and try to assist and perform surgical and aesthetic procedures, especially if your college nowadays a lot of medical colleges have come up with fellowships, at least in Bangalore, in Karnataka. So FRGUHS has a lot of post MD fellowships. So in such hospitals, the PGs get a lot of exposure to surgical and aesthetic procedures. So you can always assist the fellows and start reading theory. So first year is meant for more of gaining clinical knowledge and basic clinical skills and how to diagnose, how to read, how to write the prescription, what also to include in the prescription. Second year is when I think you should start reading the theory, start reading IDVL. When IDVL, you should start reading from day one, but start reading a little more of theory. And the last line which I've written, choose a niche. So that is why I have written that is once you complete your MD, it's always good to have one particular topic which you are interested in, but you should be able to practice like all of dermatology, because dermatology, like before it was an end branch, but it's not an end branch anymore. Like how ortho, dermat, radio were all end branches, but now in ortho you have like spine fellowships and scopy and plastic fellowships. So in dermatology as well, you have a lot of subspecialties now. I mean, I know my seniors who are specialized only. The broad fellowships are there, like pediatric dermatology, dermatosurgery, aesthetic dermatology, and trichology. But there are a few people who are specialized in vitiligo surgery, who are specialized in sclerotherapy, in treating varicose veins, and in treating ulcers. These are all very niche topics. So that cannot be practiced if you are, especially in a city or even in the periphery as well. So choosing a niche will help you become very good in that one subject. But when you're practicing after completing MD, you should practice overall general dermatology. And in the final year, Final year, most of final year is going to go with the thesis submission, and you have to do a publication. I have written the details later, and you have to start solving the previous year question papers and start reading for theory. So final year, once you submit your thesis, you'll be called exam going PGs, and that is when you have to start solving the question papers and mainly read for the theory. Okay, so these are the things which are all taken from the NMC website, that what you should do. So you should, coming to CMEs, at least 2 CMEs should be attended. So make sure that you are doing all this and you have a logbook and you're documenting all of it. The official logbook will obviously be given to you, but even in your day-to-day routine OPD, it's just good to document if you've seen a rare case, if you've done a rare procedure, or if you're attending an online CME. Post-COVID, there are a lot of online classes, online CMEs, like any online thing you attend, even if you don't get a certificate, it's always good to document it. But officially, you have to attend 2 CMEs. And yeah, the 12th point, you're required to present 1 poster, 1 paper at a national or state conference, and 1 research paper which should be published or accepted for publication or even sent for publication during the period of his postgraduate study, so as to make him eligible to appear at the examination. So you have to do 1 paper, 1 poster, and 1 publication. Even if you have sent it, even if it's not accepted, that is also okay. And yeah, this journal club and subject seminar, all this, once you get into a college, this is mainly this is going to be useful for people who don't have a very good access to like a teaching faculty. Then all this is good to do on your own. Journal club, subject seminar, you have to do it once a week. And ward rounds and teaching rounds, that is common. Yeah, this clinical case presentation, you have to do 5 cases, minimum of 5 cases every year, and make sure whatever case you're presenting, you're documenting it. 5 cases per year by each PG. And there's something called clinical pathological conference, and this should be done once a month. Okay, and then interdepartmental meetings with patho and radio. So in pathology, because most of the biopsies to pathology are sent by dermatology, because we usually do a skin biopsy in most of the cases, at least to learn, or if not to diagnose, to at least learn. So you have to have interdepartmental meetings with patho and radio at least once a week. This is the guideline given by NMC. Nobody does it. Okay, then coming to exams, this is again just everything taken from the NMC website, just to give you a basic idea about how your final MD exams are going to be. They're going to be 4 papers. Paper 1 is going to be basic sciences. Paper 2 is core clinical dermatology. Paper 3 will be STD and leprosy. Paper 4 will be recent advances. And your practical exam will have 2 long cases, 2 short cases, 10 spotters, and you have viva, and you can have x-rays and slides and drugs and instruments and all these things. Okay, now coming to the last part of the presentation, fellowships. So there are a lot of fellowships when it comes to dermatology, post-dermatology, and now most of the institutions which have a high volume center, like I'm not talking about major medical colleges, even the smaller ones, a lot of dermatologists who have a high OPD outflow, all of them do observerships for a month, or they do short fellowships for 3 months. So you can, there is no extent to the number of fellowships which are there, but the ones which are recognized are ones by FRGUHS, by MUHS. So FRGUHS is Rajiv Gandhi University, and MUHS is Maharashtra University of Health Sciences. So these two offer 1-year fellowships. That is what I did in pediatric dermatology. These are the 6 now. So dermatopathology was recently added. 6 fellowships which are given by FRGUHS and MUHS: pediatric dermat, dermatosurgery, aesthetic, trichology, HIV medicine, and dermatopathology. So all these are there in multiple colleges in Karnataka and Maharashtra. These are the 1-year ones. There are a lot of other short-term fellowships. You can actually choose the number of weeks you want to go. You can pay the doctor, and depending on the number of weeks you want to go, starting from 3 days to 1 week to 3 months to 6 months to 1 year, there is no end to the fellowships. And there are a lot of international fellowships as well. mainly in Singapore. I mean, the ones which are accessible to Indians are in Singapore, in Turkey, in Israel. So all these are basic, in Korea also, for basically for injectables and for hair transplant. So what I would advise is during your MD, decide what you want to do. So this is the decision which a lot of even dermatologists passing after MD struggle with. So decide what you want to do, and because there are hundreds of fellowships and there is no end to what you can keep on doing fellowships if you want to. So just decide on which topic you want to learn, and then you can choose a fellowship. If you are interested in learning about the international fellowships in detail, I can send you a link. There is a video on our group which has explained all the international and national fellowships in detail. So if any of you want to get in contact with me and to know more about the fellowship, this is my phone number and my email as well. So you can always get in touch with me. So I hope I did not rant too much because dermatology is something which I love, and I can't stand to see it being tainted by so many people. It's a beautiful branch and a beautiful subject, and I hope a lot more of you take up dermatology and not just think of it as glorified beauticians and appreciate it for what it really is. I also thank Kishan sir for giving me this opportunity. Thank you.
Wonderful. Excellent.